Good afternoon, everyone. Thank you for joining us here again on another week of our Native Strong Town Hall regarding the COVID-19 pandemic and the response as of, now over a year later and almost 60 weeks, roughly, we'll say.
Yep.
For those of you who have joined us on a consistent basis, we do welcome questions. We appreciate questions from all avenues. If we can, if you're joining us via Zoom, there's a little chat bubble at the bottom. Just jump in there, type it up, throw us a question. Whenever it pops in your head, we'll get to them at the end of the session. If you're joining us via Facebook Live, you can just enter us a comment there. The other thing I wanted to bring up real quick is for some of you, if you have noticed, have been throwing this into a podcast form after every session. Usually it gets up streaming on Fridays. So if you're into that format, maybe like listening to this as you're driving to work or driving around over the weekend or whatever, you can check us out. Just search on Spotify, just search Native Strong and we'll pop up. I believe there's about eight or so episodes up on there in a podcast format. So just another way for us to get out to the Native community. So again, thank you all for joining us. I'm just going to get right into it here. I'll pass it off to Mark. And thanks again for joining us, Mark. And also thanks again for joining us, you, the viewer or listener. Thank you.
Wayne Buju and the way Morgan Duke, not away Benazi and just Nakas, the main to them, Anishinaabe and Dow. The opening Dojabuk coming to you from just outside of Milwaukee now. For last week, this week, and next week, unfortunately, I'm not able to complete the show because I have to be in transportation. I'm coaching young people, which is really great. But please, that leaves it wide open for your questions as well. And I'm just going to put one of those that I would have asked towards the end of the program. And I've been getting questions from people in stores or in relatives the other night, and that is they've had a couple shots, they're walking around, and they're not wearing their mask. Do they still have to socially distance if they see someone with a mask or not? That can be taken on later or at the midline of the show. That were the questions like that. But please use that chat bubble that's on Zoom. We're familiar with that now. Be asking questions, the kinds of things that you might be hearing. Maybe you're not really sure about the answer, but you want to be solid on what you're giving to your relatives. And we're seeing a lot of powwow announcements coming up, a lot of plans when we see them of people wanting to go to their respective homes or other powwows. White Earth is a real big one. They're putting a lot of effort behind that one. And there's a lot of chatter about folks going to that one in June. And that's just a few weeks away. And I think we need to be talking about what our behavior looks like and what we're doing when we're in those crowds. Because we're away from home, we're interacting with folks we don't know, and then we're coming back home. And I don't think COVID-19's gone away. And it's still dangerous. So everyone, please have a good program. We'll visit with you and ask those important questions as we go. Thank you, Dr. Ignace.
Thanks, Mark, for the introduction. I understand that you got a thing with the thing and you got to do your thing. So go do your thing. So yeah. So Mark's had some pretty interesting leading comments that I think are important, and I think with the latest information that has come out, it's kind of an interesting proposition going on right now, because we all like clarity. We all enjoy the fact of sometimes you have to be absolute literal, and particularly around public health. You have to be absolute in your comments. Otherwise, it leads to ambiguity, confusion, and whether a statement is made and how it's interpreted, that's really about around public health, is how are messages interpreted, how could they be misconstrued. And so that's really the segue into how I'm going to start this, how I'm going to start today. Now, last week, the CDC director came out and said fully vaccinated people no longer need to wear a mask, a face mask, or stay 6 feet away from others in most settings, whether outdoors or indoors. Now, that's verbatim from what the CDC director had stated. And there were some caveats to this, but she didn't explain it when she was on TV, national TV, with this explanation. And that really does gives it more context as to what she was really referring to. Now, the statement is the statement, it is what she said, and everybody ran with it nationally. Now, what puts confusion into this is you have contradictory or leadership figureheads coming out and making variations of the same statement, and Fauci coming out with an interview with Axios that he, basically came out and said that the new federal guidance was more of a assurance to those who are vaccinated that they can feel safe, be they outdoors, indoors. Now, Fauci came out and said people are misinterpreting this, thinking that this is a removal of the mask mandate for everyone. And Fauci says it's not. Well, I think it was pretty clear as to who this was directed towards. Obviously, make an announcement to the nation, and really an announcement to people who are vaccinated that you no longer need to wear masks. I mean, I think that's pretty clear in what she said, or stay 6 feet away in outdoors and indoors. And now I'm going to go through some of that. But so we have the CDC director, and then we have Fauci come out, both, leaders and figureheads of their own government agencies. Fauci doesn't help in making his statement and on clarifying things at all. And I think everything that has happened since then just leads to confusion. And now we're in this abyss of ambiguity, of gray area and there's going to be tons and tons and tons of questions as how do we go forward. And this is why, from a public health standpoint, messaging is absolutely important to garnish not only trust, but confidence in what people are actually saying. So what I've done is I've taken the guidance from the CDC's website directly, and very specifically under fully vaccinated, this is fully vaccinated people, it says you can resume activities that you did prior to the pandemic. You can resume activities without wearing a mask or staying 6 feet apart, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace guidance. So you know what that means? At least that's what that's saying to me. I'm going to say this, but it's up to everyone else to decide what they want to do. CDC is going to make this statement, but we're going to let the federal system, state, local, tribes, and territorial laws, rules, and regulations, local health departments, local businesses, and workplaces decide. You guys are on your own on where you want to go from here. We've made the statement. Now you do whatever you want. Where I find that kind of interesting now, because before it was, we make the statement, you got to do it. Now it's, we make the statement, it's up to you what you want to do now. So mixed messaging and leading to confusion as to who we're supposed to take our guidance from. Now, a few caveats in this. Now, if you travel in the United States, continental. You do not need to get tested before or after travel or self-quarantine after travel. Okay, that's one of these caveats. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. Okay. So again, this is directly from the CDC website. So I'm not spinning any of this. I am giving you exactly what the CDC guidance is. Now, if you've been fully vaccinated, for now, you will still need to follow guidance at your workplace and local businesses. If you travel, you should still take steps to protect yourself and others. You should still be required to wear a mask. This is one of those caveats on planes, buses, trains, and other forms of public transportation traveling into, within, or out of state, out of the United States, and in U.S. transportation hubs such as airports and stations, train stations. So public transportation, whether it be Amtrak or other forms of trains, or city buses, even Greyhound, I guess, would be another form of transportation, or any airline, they're basically requiring you to wear a mask. Now, okay, that's okay. We all understand that right now. Now, as part, our agency is an urban Indian health agency, so we fall under the Indian Health Service. IHS, the Indian Health Service, has given out some guidance as well based on what the CDC came out. So fully vaccinated federal employees, fully vaccinated on-site contractors, fully vaccinated visitors to federal buildings are no longer required to wear masks. Okay, that seems pretty straightforward. How they define people who are fully vaccinated at least 2 weeks past your final second dose, and you're no longer required to wear a mask. If you're not fully vaccinated, please continue to wear your mask consistent with the requirements set forth by the Health and Human Service Workplace Safety Plan. So basically, you got to wait 2 weeks after your second dose. Now, here's this kind of read the fine print notes, because there was this whole page that I had to read to before I got to this last point, because it made it sound like, hey, here we don't have to do it. Now, at the very bottom it said, however, staff, patients, visitors, regardless of their vaccination status, should wear a well-fitting cloth mask, face mask, or respiratory at all IHS clinics and hospitals. Well, here's the thing. Indian Health Service is about 99% clinics or hospitals. There really is only a couple places that are not, like area offices, which would be what, 11 area offices, and IHS has headquarters in Maryland. They're not a clinic or a hospital. But everyone else is, so 99% of all of IHS will need to continue to wear this. And you can understand that. We all can understand it, because we're still in direct contact with patients and clients and, you know, people who come in sick. You just don't know. That's understandable. So a little bit of confusion. I hope this helps. I think being literal and saying, if you're vaccinated, you basically have a lot more liberties than people who are unvaccinated. Now, what I wanted to do was kind of give you some of these examples, because Mark had alluded to this as to what does that mean? What can we do? What we can't do? And I gave some indoor, outdoor examples straight from the CDC website. So there's two halves of this slide. On the right half, on the right side of the half is fully vaccinated people. On the left-hand side, it is unvaccinated people. So essentially being outside, either walk or run or bike, no one's saying you have to wear a mask. They shouldn't be. Attend a small outdoor gathering, fully vaccinated family and friends. Nobody has to wear a mask. Okay. Here, where it gets a little squirrely in what you can do. So essentially, anybody who's vaccinated, they can do pretty much whatever they want outdoors. If you want to attend a small outdoor gathering, if you want to dine outside, if you want to attend a crowded outdoor event like a concert or a parade or a sports event, no mask if you're vaccinated. If you're unvaccinated, wear a mask. The same is true when it comes to indoor activities. Going to a movie theater. If you're vaccinated, you no longer have to wear a mask. Attend a full capacity, well, go to church. Sing in church. Eat indoors at a restaurant or bar. Participate in an indoor high-intensity exercise class, no mask, if you're vaccinated. It's not safe, and it's recommended that you continue to wear a mask if you're unvaccinated in any of these types of activities. So how does that apply to natives in our kind of cultural and kind of spiritual activities? Attending an outdoor powwow. Now, it's not on the CDC website, but kind of following the theme of how they kind of decide who can and who can't wear a mask, or who should wear a mask. I think people who are vaccinated, I think certainly have the liberty of not having to wear a mask or an outdoor powwow. Okay. I know the question will be, what about sweats? I think we're getting to a point now, attending a spiritual wellness event such as a sweat, if all the participants are vaccinated, following the theme of what the CDC outlines, it certainly would appear that all participants would be safe. Now, the caveat here is everyone needs to be vaccinated. If there are unvaccinated people in an event like this, I'm not saying all bets are off, but there's a higher level of risk, even for people who are vaccinated. So those are the two main things. And I know as summer comes, we're all going to be outside. We all have, for people who have kids with outdoor events, sports, activities, it would certainly appear, given the theme here, that families who are vaccinated certainly have the liberties of not having to wear a mask. Now, the problem comes in when we talk about summer camps. I think I presented almost a year ago, last summer, there were summer camps going on. And at that point, we're saying the articles that were being published were saying, hey, kids should be in school, kids have lower risk of getting infections. And then once summer camps start and have big crowded groups of young people together in cabins, sleepovers, and the such, I think this was in Georgia. Well, guess what? You had big old outbreaks happen. Now, that's kind of the same scenario now. We have a younger population going into summer, possibly summer camps, and the question now has come up, should they go to camp? Well, guess what? If you're 12 and younger, or even if you're 16 and younger, and you haven't been vaccinated, you're basically in the same situation as you were a year ago, with the potential for outbreaks. So that's still a real possibility. That is still a real possibility of transmission of COVID. So you know, as far as right now, maybe camps, overnight stay camps, week camps, maybe they're off limits now. You know, mass certainly, but you can't absolutely guarantee that your little ones are going to be running around in masks 24/7, because that ain't going to happen. We all know that's not going to happen, right? So those are the kind of scenarios that we're talking about and how it applies here in Native country. Powwows, outdoors. I think there's a lot of liberties people who are vaccinated could take and not have to wear a mask. Obviously, the caution comes for unvaccinated people and individuals who have comorbid, a lot of underlying chronic health conditions who have not been vaccinated. Yeah, they're the ones that the most vulnerable and most at risk. And so there's just a level of appropriate behaviors, I think, if for unvaccinated people, that they need to continue to be careful. For unvaccinated people, given the activity, whether it be indoor, outdoor, I think your level of concern will dramatically go down. And so that's where we are from the mask and what the CDC has come out. I hope that kind of clarifies things. I know it's a little difficult given everything that we've heard. I know states, governors are looking at dropping mandates on masks. You know, I don't think it's so much governors dropping mandates on masks. I think it's more about kind of following the guidance that CDC has come out for fully vaccinated individuals. We're not saying the pandemic's over, because obviously there's continued ongoing infections that are occurring. But when it comes to vaccinated individuals, there are liberties that can be taken and not having to wear masks. So I hope that clarifies things. Now, we've seen this profile, this table outline of Pfizer, Moderna, Johnson & Johnson. I don't know what's going on with Johnson & Johnson. I don't know if they should just pack up tent and go home, because nothing is working for them very well. This, what I'm going to say, doesn't garnish much effort or, you know, ink in the paper. But Johnson & Johnson did go through its FDA emergency use authorization. They got their approval. They started rolling things out, and then things kind of grinded to a halt. I don't know if you guys remember this. I talked about this before. Johnson & Johnson had to stop and drop 15 million doses for cross-contamination to their manufacturing because of contamination. I think everyone remember that. Then they got the okay, and then things went out, and then all of a sudden the CDC put a pause on its administration. We all remember that, and with the rare clotting disorders that were occurring, not just here in the country, but also a similar vaccine like AstraZeneca overseas. So that was a whole big old thing in production. Well, guess what? Now that the CDC has approved and really has given kind of a warning and allowed the administration of Johnson & Johnson and that the benefit of vaccination with Johnson & Johnson outweighs the risk of developing these clotting disorder, they authorize it to move forward. Well, guess what? FDA came out in the last, 24, 36 hours saying, wait. You can't deliver Johnson & Johnson because the people who came in and evaluated the manufacturing plant said, hey, there's safety violations here at the plant. Things aren't going well. We have to test and sample these to make sure there is not anything wrong with the vaccines that are being pushed out. Well, guess how many that is? It's not a little, and it's certainly not a lot. It is probably the whole thing. 100 million doses of Johnson & Johnson are put on hold for distribution. That means nothing. Johnson & Johnson has had the absolute worst luck. And, you know, rightly so, things have to be stopped. I mean, these are sterile compounds that have to be manufactured in the most proper way, because you're looking at mass distribution of millions and millions of people. You've got to get it right. And they haven't been able to get it right. So Johnson & Johnson is on hold, not by CDC, but by the FDA now, because they violated safety protocols and violations at the plant. So I don't know what Johnson & Johnson is going to do. I really don't. We've had such tremendous success with Pfizer and Moderna. Given the trajectory of how the supply of that in the U.S. is right now, I don't know if we need Johnson & Johnson right now. I really don't. But that's my own opinion. I don't run the country, so I can't make that determination. I'm just saying 15 million doses had to be wasted. Then we had to pause. Now we have to hold another 100 million doses, a million doses. This stuff is never going to get out into circulation. It's unfortunate. It really is unfortunate. And these are mistakes that could have been prevented and certainly evaluated prior. And it just has been this way clunky effort of getting Johnson & Johnson out that I don't see anyone's going to put any stock into their vaccine now. So, but we still have Pfizer, we still have Moderna. All right. Looking at the variants, I kind of give this as an update of what's going on here in Wisconsin. Samples that have been given out, that have been sampled from COVID positive individuals in the state of Wisconsin, they're sequenced and looked at what type of the virus, coronavirus, are we talking about? Are we talking about the original, the wild type COVID-2 SARS virus, or are we talking, are the variants showing up? Well, variants are showing up. They are showing up in all reaches of the state, but predominantly the B117, the UK B117 variant is the prominent, by far the most prominent variant that is showing up. The P1, hardly anything. The South African B1 351, hardly anything. The California variant, there is some, but about 75% of all variants in Wisconsin are the B117. Now, for people who've been vaccinated, whether it be Pfizer or Moderna, just rest assured that you still have a very high level of protection against the B117. 90% protection against COVID, and nearly 100%, whether you had Pfizer or Moderna, 100% against severe disease. And this includes the B117 variant. So I think that gives me certainly a huge peace of mind knowing that I've been vaccinated with Pfizer, that not only am I protected against the original virus, but also against the variant UK, and that my risk of severe, even if I did get COVID, my risk of severe disease is, I'm not saying it's going to be absolutely zero because nothing's perfect, but my risk is significantly low, significantly low. Now, I've been mentioning India, what's going on in the world. India, of course, is going through their tsunami of infection right now. The upside to this is that the count, the daily count of infection is starting to slide and go down, and it will continue to go down. The problem right now isn't so much testing and identifying individuals. The problem right now is their health system and their capacity to handle the sick, the severe disease individuals who require hospitalization. And now there's nearly setting record fatality deaths a day of over 4,000 every day, 4,000. That is a lot. That is a lot. That is a lot. Certainly more than what even the United States had to endure back in the late fall, early winter. So, but the numbers are going down for India, just like the numbers are going down here in the United States, averaging about 27,000 cases a day. That's not bad. That is really not bad. Compare Brazil is kind of this undulating, they've plateaued, they aren't really going anywhere, they're kind of stuck at the same rate for months. France, they're on a downslide. Israel, something kind of unique, and this may be part of what's going on in the Middle East right now. I'm sure all of their testing and capability is completely disrupted, but they've been reporting 0 cases of COVID over the last 2 weeks. I'm sure part of that is due to all the unrest and conflict that's going on there. But in here, we look at the UK. The UK is ever so sliding down. They are now less than 2,000 cases a day, which is pretty remarkable, and really an example of what herd immunity should look like, given that more than 70% of the country have been vaccinated. And you can obviously see the endpoint benefits of vaccinating the vast majority of the population. So let's get to some points that I saw in the numbers over the vaccine effort here in Wisconsin. So this is single dose profile of the state of Wisconsin. 45.7% of the state have been at least single dose vaccinated. Almost 2.7 million doses have been administered. When we start looking at the numbers a little more closely, we see that the new age group, the 12 to 15, is a new category that's been added. And as of yesterday, 22,875 individuals have been vaccinated with at least 1 dose. Okay, it just opened up. It's a new category of people, and demand seems to be fairly high in assuring that 12 to 15-year-olds get vaccinated. Now, when I look a little more closely at the intervals and the number of new individuals that have gotten shots, in that middle section, you see the number of single doses in the past week. May 19th, that column is the number of new individuals that have been vaccinated by race or ethnicity. Now, when I see Native Americans, 545 compared to last week, 595, and the week before that, 732. Obviously, a clear decline in the rate of new individuals getting vaccinated. Now, when I look at the other race or ethnic categories, you see a much different picture. So with Asians, Black, White, Hispanics, the numbers have actually gone up. Natives have gone down. Everyone else has gone up. And when we see what that looks like in the rate of percent change in the past week, we see that the rate continues to decline for natives. All other races, ethnicities, ethnicity and races, their rate has taken a bump up. So what is the contributing factor to this? And it really is only one real explanation as to why that is. It's the 12 to 15-year-olds getting vaccinated. That is what's contributing to the increase in the number of new individuals getting vaccination. There's no other way to explain that other than we have a new group that are now part of the mix. Now, the downside of this is you can say, well, if every group is benefiting from 12 to 15, it's not obviously it's not showing in the native population, where it actually has gone down. So looking at the numbers and just knowing what is new and going on, my concern moving forward is that this rate of decline is going to continue, and that we may not see the benefit of vaccinations in the native community for the 12 to 15-year-olds, because this is really parent guardian dependent. Obviously, parents, guardians have to give consent to minors to give vaccines, not just this vaccine, any vaccine. So whenever you go to the clinic, parent guardian has to give permission. They have to sign over saying, yes, I'm willing to allow my child to get treatment or vaccination, and vaccination is no different. The Pfizer vaccine is no different. So this is really a reflection now of the parent and the guardian giving permission for their children. That's really what this is going to end up being. That bottom line is to what's going to drive this vaccination rates for the younger population. Looking at fully vaccinated individuals, the state's almost at 40%. Here we have distributions across all races and ethnicities. I have talked about when this peak has occurred, at least in the native population. It occurred back in April. And since then, that has been steadily declining, just like everyone else. So that isn't nothing new. It's just stating what I see. Looking at how the state is doing overall. Now, 4.9 million doses have been administered. You see Johnson & Johnson, Moderna, Pfizer in the mix, with Johnson & Johnson way distant third. But what's interesting here, and I just want to make this as an observation, when I look at the numbers, what I see in the data table, when you look at May 19th, we see that 4.9 million doses administered. The average is now 24,000 doses. The 7-day average is now 24,000 doses a day. Now that's declining. It's declining from the week before and the week before that, and we're looking at 1, 2, 3, 4, 5 straight weeks of decline on the average. Now, what's interesting about this is that in the past week, we know that 22,875 kids between the ages of 12 and 15 have gotten a single dose vaccine. That's an average of about 3,300 people, 3,300 kids per day. If we did not approve of the 12 to 15, we'd be actually talking about the single dose average being about 21,000. And that would be even more devastating in terms of the vaccination rate. So it is declining, even though we have a new group to vaccinate. The rate of vaccination, the averages are still dropping, and dropping to a point where I don't know how effective opening up the 12 to 15 will be in moving forward. Now, when we look at what's occurring here in the United States, overall, we see that the decline is continuing to go on. As I mentioned, a new group, 12 to 15, you would think maybe we would get a bump in numbers, or maybe the trend would be flat. Well, that is not happening. It is not happening at all. And so now we're at a point here where we're talking about the average of 1.5 million doses per day. And in spite of adding a new category of people eligible, the rate has still dramatically declined. Now, I'm going to bring this up because I think it's an important point moving forward, because we've heard July 1 as being this critical day, July 4th weekend as being this day of maybe when this pandemic's going to be over. Well, part of that is knowing, projecting, estimating how this virus is going to play out The other part is we have the introduction of vaccines, which plays a much bigger part in when we can kind of throw our hands up and say this is over. Is that herd immunity, that critical threshold point of 70%. That's kind of what's being touted now as that critical threshold point where a community or a country reaches that threshold point of 70% either have been vaccinated or have gotten the disease before the virus does not have the ability to transmit and infect people. That 70% is about 228 million people here in the United States. Now, when we talk about that herd immunity, that critical threshold point, we're not talking about subsegments of populations. You can't talk in those terms because that doesn't work. It doesn't apply well. And what I mean by that is you just can't say, okay, state of Wisconsin has 70%, everything's fine, it's all over. You got to take everybody from the oldest American to the very newborn of infants into the world. Everyone is included. That's 325 million people. I'm sure there's more than that, but on record, there's 325 million. So that critical threshold is 228. If you look at that top segment, the percent of total population, 47.9%, or 159 people, that's where we are right now that have been fully vaccinated. So what does that mean between now? That's 40, that's 68, let's just say round number, 70 million new people need to get vaccinated. 70 million more people. I'm giving you the rate of what we're doing right now, and you could figure this out. You're gonna have to get a big piece of paper. But the rate of decline in the administration of doses that are occurring right now by July 1, we are talking maybe 48, 50 million new people. That would give us about a fully vaccinated rate of about 62 to 63%, and that is way short of the 70% that all the experts are talking about. Now, I personally don't think we're going to get there. It's already been shown the rate of decline is way too much to bear, and that July 4th date is not going to happen. It may happen by Halloween, but I don't see it happening July 4th, that 70%, just because of the rate of decline. Even by introducing the 12 to 15-year-olds eligible for vaccination, you would think there'd be such a mad dash rush to do and get these vaccines into these kids and maybe change the trajectory of how this is going. It's already been a week and it hasn't even made a dent, which tells me that the adults, the demand from the adults is so overwhelmingly to not get it that is blunting any effect that we may be seeing from the 12 to 15-year-olds. That's what I'm seeing. That's what the numbers are showing. You can't get around numbers. You just can't. I mean, accountants can, but when it comes to straight numbers like this, the numbers are the numbers are the numbers, and the numbers don't lie. So now, I'm trying to be upbeat here, but when we start looking at what's going on in the country, so what kind of case rates are going on in the country? Well, we see Florida, Texas, Pennsylvania, Illinois, California, state of New York, all are, kind of above that 10,000 case average per day. These 6 states make up probably close to about 40% of all infections in the entire United States. So these 6 states, they're probably one of the more populated states, but they comprise 40% of all infections. If you start looking at other states, maybe where you're from, Michigan, Illinois, Minnesota. I have to laugh because I just said Minnesota. Just I used to live in Minnesota. I had that accent, Minnesota. So, and then you look at Wisconsin. So, we're exactly, I'm living here in Wisconsin, so that number is exactly where it should based on population, based on rates, and the rate of infection for a population of our size. We're right in smack dab in the middle where we always are in everything, and that's fine. That's where we should be, but the rate is starting to go down, and the rates here in Wisconsin, just like in the Midwest, are trending downwards. And looking at what's going on in Indian country, so we look at area offices, areas in IHS, the 11 areas. We look at aggregated roll-ups of the number of tests being done, the number of positives to date. So as of 2 days ago, the rates, the number of new infections by area, there's really only 2 areas in the country that have shown a modest increase. And they are increases, but they're comparatively to what we have been seeing, they're pretty small. Great Plains and Phoenix area have shown to be kind of high watermarks for their trend there. What we look at overall, what I look at overall is that there's only been 681 new infections in Indian country by IHS data. Now, with the introduction of vaccines back in late December, since then we've had 11 straight weeks of decline in new infections. We took a kind of a bumpy road for 4 weeks. Then we had a downturn, and now we're at 681, and we seem to be back on track of what that trajectory should have been if it wasn't for that bump in the road. So we seem to, in Indian country, we seem to be back on track of where we should have been maybe a month ago, and now we're hopefully, with the summer months coming, this continuation will continue to slide, and I think this is really a contribution to the vaccine and the rate of vaccines that have been occurring in Indian country. So when we look at the region, the area, Bemidji area, Wisconsin, Minnesota, Michigan, we see the number of confirmed cases, aggregated confirmed cases, in parentheses is the number of new cases in the past week. Michigan and Minnesota are sliding a little bit, but they still are much higher, almost 3.5 times higher than the state of Wisconsin. When we look at the overall rate by native population by state, Michigan 7.6, Minnesota 7.7, Wisconsin still very high at 13%. So I've shown this, and it's really to make the point that the rate of single dose vaccination per 100,000 by ethnicity and race here in Milwaukee County. We see that the yellow line representing natives in Milwaukee County, there's been 2 significant increases in the rates of vaccination. Since then, the rates have been declining. But not just declining by natives, it's all races are declining at the same rate collectively altogether. So, but when you look at this, you can clearly see that the native population in Milwaukee has significantly benefited from 2 vaccine campaigns that we hosted for the area. Now, when we look at the percent of single dose vaccinations in Milwaukee County, again, we're looking at by race, so white, native, Asian, Hispanic, blacks. We see what the rates are: blue representing last week, yellow, orange representing currently. All races are incrementally increasing at a slow rate. We see that the native population continues to increase. We're at 42%. And then as we go by, Hispanics are 31%, and the African American community is at 24%. That's pretty significant when you start looking at these numbers, what the the population of each one of these groups are in Milwaukee County. And we're talking close to what, maybe 800,000 people in Milwaukee County, almost 1 million people in Milwaukee County. For, let's say, the Black community, only 75% of the community here. We're so far into vaccinating campaign. And the availability is widespread. I mean, you can't even go into a pharmacy now without being asked. Not asked. I mean, the availability is there. You just walk in and it's like smack dab in your face. You want a shot, and so it's everywhere. I don't know. Looking at this, if we're looking at incremental increases of 1% every week, I mean, it doesn't take a rocket science to figure out. We're on a slow boat here, and I don't know if we're ever going to get past that critical threshold point for Milwaukee County as a whole, that 70%. I mean, we're looking at probably close to 300,000 more people that would need to be vaccinated. At this rate, I don't know how we're going to be able to do that, because it's just not, the numbers are just not increasing how you would like to see that movement in the community. So it's the demand is definitely not there. When we look at what's going on in the state overall, as of May 19th, the 7-day average is now 394. The week before it was 491. If we look at it historically, what's going on in Wisconsin, we're talking about June 27th of last year, May 19th now, June 27th, 392. We're kind of on that trajectory to be, if this continues to slide in the next couple of months, we could be looking at probably less than 200 infections a day. And that's really where we're at right now. How we're looking is looking at that continued slowing and slowing and slowing. People are going to see this and they're going to think, well, if it's slowing that much, and it's been 18 months now, do I need a vaccine now that we're at the tail end of this and hardly anyone's getting infected? I mean, these are all personal decisions that people will need to make. Now, I updated this last slide because I thought it was important. At least it was last night when I was looking at it. Now, the top part I've shown quite often. It looks at all of the demographics. But what I wanted to highlight, since the new category of 12 to 15-year-olds are now being introduced in this, so they need to be talked about. Not only as the rate of infection, but what's their hospitalization, ICU, and their fatality rate. On the very top half, you see that orange bar outlines the total number of kids that are 10 to 19, almost 740,000 kids in the state of Wisconsin. 72,000 have been infected, 9.8% rate of infection. Their hospital rate is 0.9. ICU admissions is 0.02, and their fatality rate is 0.004, with 3 fatalities in the entire pandemic era of data counting here. Now, if we look at what's occurred in the past week, 496 kids, 10 to 19, that's almost 18% of all infections are attributed to this age group. Only 15 have actually been hospitalized, 3.5% of all cases, 0 ICU, and 0 fatalities. Now, that's pretty consistent with what has gone historically over the last 8 months. And we're talking about vaccinating 12 to 15-year-olds. With these kinds of numbers, I'm sure every parent they're probably sitting down and talking about, do we or should we vaccinate our kid with these kinds of numbers? as it is declining. Now, what is new, what I put in new here, and I've been tracking this ever since for a year now. I don't show it because this is kind of geeky number stuff. But I combine both 0 to 19-year-olds. So basically, I'm looking at K through 12, school age kids. There's let me see, there is almost 1.5 million school age K through 12 in the state of Wisconsin. Looking at the overall number of infections, almost 100,000, or we're looking at the percent of COVID cases of K through 12, 6.8% of all COVID cases were attributed to this age group. That is the lowest number of all age groups since this has started. Now, when we look at K through 12 who've been hospitalized with COVID, less than 1% of all kids K through 12 have been admitted to the hospital. That's less than 1,000 people. Again, that is the smallest rate of all age groups that have been admitted to the hospital. When we look at ICU admissions, 0.037%. Only 37 kids over 18 months, over 37 of 100,000 kids have actually been admitted to the ICU, and there's been 3 fatalities for a rate of 0.003. With those kinds of numbers, I mean, it really, families are going to have to think hard and true, looking at what the information shows you, what you want to do for your kids. Now, I'm not saying one way or other, I'm just giving you the numbers. As a family, everyone needs to make informed decisions for themselves, but I'm just giving you the rates. And it's important moving forward as to how you want to look at moving forward, especially in the next several months over summertime leading into school. And that's going to be a whole other debate. When school time comes, the question is going to be who's vaccinated and who's not. Who gets in, who stays home, who has to wear a mask, who doesn't, blah, blah, blah. It's coming. I know it's coming, and it's going to be unfortunate because it sounds like arm twisting to me, what's going to happen. But Jeremiah, I'm going to kick this back over to you, and you can certainly let me know if there's any questions that have come in.
Yeah, we're kind of close to the end of our time here, but I will, there's a couple that came in, especially regarding, there's one asking, and I know you've mentioned this before, but, a person has both shots now, recently hearing that you would need to get a third. I don't know if you really just want to mention that quick.
Yeah, so what the person's alluding to is a booster. It is a booster shot. And these booster shots are more like, let's say, Pfizer and Moderna, who are kind of leading the effort here on boosters, is really against variants. And there's something cool that has just come out recently, and I'll bring it up next week as to what cool, geeky nerd science stuff that's coming out regarding vaccines and this vaccine that's being created or looked at, how it could be the savior of all vaccines when it comes to this. But anyways, boosters. Are people going to need a booster? And the answer is going to be more than likely yes, because we're looking at the antibody development and the memory of your body of withholding the ability to protect you. We know now that there's at least 6 months, the 6-month window of retaining the ability to respond. But I'm sure in the next month or two, there's going to be a month that says, hey, 9 months, yeah, you can still retain. And there's going to be, after a full year of vaccines being out, it's going to say, yeah. So we're looking at probably close to 12 months to 18 months of fully retaining the ability to combat the virus and the variants such as the UK or the South African. Boosters are going to come into play this fall and probably early winter, And this is really looking at guiding the effort to protecting to any new kind of variant that may come down the road. Now, I'm going to leave it there because that's where this other science methodology is going to come in and come into play, and how a booster in the late fall, early winter, it may just be a one-shot deal, and it may cover everybody, regardless if you've had vaccine or not, whether or not you're going to need a third, or how's this all going to play out. It's going to play out, and I'll explain that next week.
All right, and we got another one that's so family just coming into town from out of state. They had COVID 2 weeks before they came. You know, I think are over it, is what it sounds like. Person who lives here has their shots, has had their shots, but the visiting family members have not had their shots. The question was, you know, should they stay away, kind of keep their distance, or, you know, what would the recommendation be there?
So, well, so you said the visiting family had back COVID and has recovered.
Yes, 2
Okay.
weeks, 2 weeks, yeah, prior.
And the family that they're coming to visit have been vaccinated.
Yes.
Yeah, I think you guys could all hug each other. So here the guidance by the CDC. People who are vaccinated, and that I'm going to go to it right here. If you've been around someone who has had COVID, you do not need to stay away from others or get tested unless you develop symptoms. So now that the family who's coming had it, they've recovered from it, you know, they're fine. People who they're visiting have been vaccinated. They have a high level of protection. They should have a full family engagement without any restrictions or even mask wearing.
All right. So, and then, you know, obviously in a big kind of around the, you know, Milwaukee area, I guess Wisconsin in general, pretty much everywhere, following your, you know, I guess the CDC's maybe not very clear guidelines. You know, everybody's kind of taking down their mask mandates at different stages. You know, Milwaukee's going to be June 1st. I believe, you know, some other municipalities around the Milwaukee area have already done that.
Mm-hmm.
You know, for people who are vaccinated or, you know, maybe even not vaccinated, what's your recommendation for those folks that are, you know, going out to the grocery store, doing the things that, you know, going to the gas station, doing those things that, you know, per recommendation from the CDC, you know, you could probably go back to doing as if pre-COVID, if you're vaccinated. But, you know, it seems like it's just now with maybe a wide range of people being out there that aren't vaccinated, you know, going about their daily life like they are vaccinated, it just seems like an interesting conundrum, I guess, for me. And just wanted to get your point on that. And then you can have the last word after that as well.
So the dynamic right now, and was it premature to make this announcement about the mask? I suppose you could make that case. Should we have waited? Sure. Could we have defined better metrics to say, hey, if a rate of infection meets this mark for 2 weeks, hey, you know, that would have been a much clearer indication to assure not only municipalities but states and the entire country that, hey, this is on its way out. Now, as I explained through what the CD is trying to clarify, and the articles that I presented from previous presentations, is being vaccinated, whether it is Pfizer or Moderna, your level of protection against the original virus is 94% plus. This is just from getting the infection. Against the variant, 90% against UK, 75% against the South African. These are still really good high numbers in prevention. So being vaccinated certainly gives you, I'm not going to say it puts a big S on the front and you run around with a cape, but I certainly will let you feel, it certainly will let you feel that you will have more liberties to function without a mask than people who are unvaccinated that have zero protection. And that's really how it's going to come boil down to is, you know, how risk adverse do you want to be? Now, you can get vaccinated and be fully protected, but if there's a level of you want to be, comfort that you absolutely don't want to get it, wear a mask. There's nothing wrong with that. I think the people that are unvaccinated that are running around creation thinking that it's over, that's kind of the wrong frame of putting this with what the CDC put together, because if you've never had it to this point, you're not vaccinated, you really don't have any protection against this virus. And so I think people need to be true to themselves and true to their families and their level of risk that they want to take. Now, from that, people can have their own opinions and thoughts on what that means for them. And this really will come down to an individual's choice and decision how they want to proceed, whether it's vaccinated mask or no mask, or unvaccinated mask or unmasked. It's going to be an individual choice. But I will rest assured people who do get vaccinated and they do have these travels to the gas station, grocery store. I mean, the CDC is clearly outlined, even going to the mall, movie theater, all these things, going to church, singing, going to ballparks, or events without a mask. They wouldn't say that unless they had pretty good confidence and a high level of confidence that these vaccines really do work. And I'm in agreement with that. And one of the reasons why I feel that people should, particularly adults with high-risk conditions, definitely should get vaccinated. If you haven't, I'd definitely call your provider where you can get that. So with that, I'm going to stop. We got some leading topics to talk about next week. So until next time, everyone, stay strong. Thanks, Jeremiah.